Hospitals in China are overwhelmed. New confirmed cases are adding up by the hour. Despite strict containment, the coronavirus has jumped to at least 18 countries, creating the potential for foreign outbreaks.
For all of these reasons, I'm declaring a public health emergency of international concern.
This extraordinary step was taken to better coordinate resources, research, and measures to stop the spread of the virus.
We don't know what sort of damage this virus could do if it were to spread in a country with a weaker health system.
Health officials are already seeing a troubling development in cases outside China. At least 4 cases of person-to-person transmission in Vietnam, Japan, Germany, and now the U.S.
This second case did not travel to China, making this the first person-to-person transmission of the novel coronavirus in the United States.
Countries are being extra cautious, advising against travel to China, even quarantining an entire cruise ship against the advice of the WHO, which seems determined to praise and protect China.
This is the time for facts, not fear. This is the time for science, not rumors.
This infectious disease doctor says the WHO had little choice but to call the emergency despite China's best efforts.
We always recognize outbreaks in hindsight. And so now they're playing catch up and they're being very aggressive trying to control this. So you can actually congratulate China for being really aggressive, but at the same time say it seems to be getting away.
China is putting a brave face on its containment efforts, celebrating the discharge of recovered patients as the number of hospital admissions grows. Vic Adopia, CBC News, Toronto.
So, does a global public health emergency require new action from Canada? Well, that question was put to the health minister today.
We are actually up to date with the recommendations of the World Health Organization. I think there's an implication that we need stronger countries need to support the weaker countries in the world.
So the minister's saying there Canada doesn't need to do anything differently from what it's already doing. So let's talk about that. Dr. Susie Hoda is an infectious diseases physician. Just on that point, I mean, what are the lines of defense that are in place in Canada such that Canadians should be reassured of what the government's saying?
Right, and I completely agree that we are prepared for this. So the first thing is being able to detect anybody who might have this kind of infection. And that requires not only having good screening processes in place at the portals of entry to our healthcare system, as well as in places like airports, which may or may not help to actually detect people as they come into the city or into the country, but could be an added measure. So being able to detect is important through screening, but also through diagnostics, so having tests available to actually find cases. But beyond that, having surveillance systems and being able to collect that information and feed it back appropriately to all the different levels of our healthcare, our public health system, and internationally share that information. And that helps to guide some of the containment strategies. So that's some of the important components. And then, of course, if we find cases, being able to follow up on people who are actually contacts of those cases, right, and being able to have a good strategy in place to monitor them and have them followed properly.
So then speak directly to those people who are still worried, even right, despite that. I mean, like people who have that kind of gnawing question in the back of their mind, but couldn't all of this change on a dime?
Well, things are rapidly changing, and I think that's part of what's fueling the concern of a lot of the people who are alarmed, right? Yes, things change rapidly in these emerging infectious diseases, but that should alone not be enough to get people alarmed, right? We have to have trust in our public health system and in the people who are actually dealing with this problem. So, I think it's the big message to get out there is be concerned. This is a public health issue that's facing the entire world, but there's no need to panic at this point.
Dr. Hoda, thanks for being on.
Thank you.